About 3.5 million people in this country are living with chronic hepatitis C. If you look at the numbers more closely, you'll see our veterans are at 3 times greater risk of being infected compared to the general population. Our guests are committed to increasing awareness about hepatitis C, including screening. Dr. Kenneth Rothstein is a board-certified physician in internal medicine, transplant, hepatology, and gastroenterology. Joe Banco is a veteran who was cured of hepatitis C. Gentlemen, good morning.
Good morning, Mary.
Morning.
Doctor, give us a definition to start, if you would. What is hepatitis C?
Hepatitis C is a virus that affects the liver. It can cause serious complications, including cirrhosis, liver cancer, and the need for liver transplant.
What are some of the risk factors?
It's very important. Well, the risk factors are anyone who ever used intravenous drugs and anyone who had a blood transfusion or blood products before 1992.
If someone is at risk, high risk for hepatitis C, what can they do?
Well, if you're at high risk for hepatitis C, you need to be screened with a blood test. But the majority of the patients in the United States don't know they have it, and that's why the CDC came out with these recommendations. Any baby boomer born between 1945 and 1965 needs to be screened because they make up the largest group age-wise of patients in the U.S. with hepatitis C. And as you said before, veterans are also at high risk, and they need to be screened as well,
Joe,
especially Vietnam veterans.
Joe, how did you find out that you had hepatitis C?
When I got out of the Army, I worked for a company that they had a blood drive, and I was donating blood on a regular basis. And in the early 1990, they started testing for that. And that's when awareness came out that I had hepatitis C, and I could no longer donate blood, which was confirmed, and the diagnosis was confirmed by my family doctor. But I didn't have any feelings of fatigue other than fatigue, and I just thought that was old age. So it is a very silent killer, because later on I did have mild cirrhosis once my liver was compromised with the length of it being in my body.
So when I say you were cured, you're okay now.
It's amazing. I had an opportunity to get on a clinical trial, and the clinical trial lasted for 12 weeks. And at the end of 12 weeks, I had been tested, and it was no longer a virus in my body. They waited 3 months after that, and they diagnosed me again with it out in my body. So I was clinically and cured, and it was the best Christmas present I could have ever received.
Wow. Doctor, that's a powerful testimony there. What can our viewers do as we were listening to you speak about those guidelines? If they feel like they're at high risk, where can they go online to learn more about the guidelines and then also some of these innovations in treatment?
Well, again, they should go to their doctor to get a hepatitis C antibody test to be screened. There is a great website available. It's hepchope.com. Has a lot of information about the disease and the treatments that are available. It's very informative. I really would want to emphasize that patients who fit these risk groups should definitely go to their doctor and get screened with a special blood test for hepatitis C. It's very important.
Dr. Rothstein, Joe, thank you for sharing all of this with us today. We appreciate it very much.
Thank you for the time.
Thanks.
It's our pleasure. And the Morning Blend